Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 5-year-old boy is brought to the pediatrician with a history of chronic cough, recurrent respiratory infections, and sinusitis. He also has a history of neonatal respiratory distress syndrome and otitis media. His parents indicated to the pediatrician that their son had been experiencing a lot of respiratory problems and that the two siblings of his are also having similar issues. So my friends, this is the case study before us and we have some questions to go through. Now the first question is that based on the clinical some symptoms, signs and symptoms, the manifestations, what is the most likely diagnosis? And my friends, your answer should be primary ciliary dyskinesia. Primary ciliary dyskinesia. Now, my friends, one thing I need you to understand is that sometimes, someone may also bring in the concept of Kartagener syndrome. Yes, no doubt about that. So in that case, what will be the differential diagnosis? Now, understand that the broader picture, okay, is what we call primary ciliary dyskinesia, and a subset of it, or a special case of the primary ciliary dyskinesia is what we are calling the Kartagener syndrome. And so how do we draw the line? My friends, it's pretty simple. One thing that we need to understand is that in the case of what we call the primary ciliary dyskinesia, yes, of course, the manifestations, as we've been saying, the first one is that, of course, there's that kind of chronic cough. Yes, for what reason? The reason is that there's something called bronchiectasis. Okay, so once there is that bronchiectasis, then what is going to happen is that, yes, of course, once there's that kind of chronic inflammation of the bronchi, say that it has become dilated, okay, then of course the cough, pattern is likely going to be there. Yes, the key point over here is that there is an issue with a gene that is responsible for ensuring that it directs what we call the synthesis of the relevant proteins needed in what we call the formation of cilia and its function. Okay, so in that case, what will happen is that your ability to remove a lot of what we call the particulate matter from the respiratory tract as you inhale the air will be impaired. And so it makes sense that there's going to be that kind of inflammation to the bronchi, bronchiectasis, okay? And that may lead to that kind of chronic cough that this patient was experiencing. So that's number one. No doubt about that. Now, the other thing is that, there's also going to be that kind of sinusitis that we mentioned, okay? Sinusitis, okay? Inflammation of the sinuses for the same reason that, of course, a lot of what we call the particulate matter, the pathogens finding themselves over there, which are not cleared by, of course, the mucociliary, escalatory action. Yes, and it means that a lot of mucus, a lot of debris will be in there in the nasal cavity, and then of course may lead to, of course, this paranasal, sinuses getting inflamed, leading to, of course, this sinusitis we're talking about. So no doubt about that. Yes, we talk about this individual experiencing some kind of neonatal respiratory distress. Yes, for the same reason, especially if you are a neonate, then that will be your condition. You may have difficulty in, of course, breathing. And then, of course, we've also mentioned that this individual was experiencing some kind of otitis media. Yes, when we talk about otitis media, then of course we are talking about inflammation, okay, of what we call the middle ear, happening in the middle ear of the ear. Now, the point is that this individual's case was actually a frequent one, a recurrent one. And what's the reason? Yes, for the same reason, if you look at the middle ear, Okay, and for that matter, eustachian tube, what will happen that we have some kind of, hair-like, motile hair-like, structures over there, which are supposed to ensure that the fluid is not, yes, accumulated over there. But in situations where, of course, you are having primary ciliary dyskinesia, then you cannot clearly, take away some of these things out, and therefore there will be that kind of buildup of what you call, this, what do you call it, fluid in there, and may lead to that kind of, frequent or recurrent, otitis media, inflammation of the middle ear. Now, my friends, one thing we need to understand is that now, for the same reason, if this individual is a male, then of course in future may have some kind of infertility issues. The reason is simple, because the same gene that directs, of course, what we call the cilia to be formed, yes, the same thing which we need in the formation of the flagella, okay, of what we call the functional spermatozoa. And so what is going to happen is that there will be difficulty in that kind of motility of the functional spermatozoa. And so what is going to happen? What will happen is that it will be difficult for this spermatozoa, actually, to swim, of course, get to, of course, the secondary oocyte to fertilize it. And so what is going to happen is that most likely this individual may have what we call, infertility in this regard. Okay, that is one thing I need you to understand. In the case of a female, because this case was for the male, if it had been for the female, then what will happen is that there may be difficulty in, no doubt about conception, but the only thing is that difficulty in bringing the conceptus from the fallopian tube or the uterine tube or the oviduct, okay, down into, of course, the uterine tube, okay, for, of course, the growth and development of the embryo. And so what is going to happen is that there's more likely for what we call the tubal, ectopic pregnancies taking place if it had been a female individual. So these are the classic things that you may be seeing around it. Now, one thing I need you to understand is that in about 50% of the cases, primary ciliary dyskinesia, and that is where I'm bringing in the other concept of Kartagener syndrome, you may have what we call, situs inversus. Okay, so in situs inversus, what we see is that, yes, normally organs which belong to the right side, okay, may be shifted. Okay, the major organs may be shifted to the left side and vice versa. So for instance, we expect that the heart, its apex, we expect it to be, of course, related to what we call, it should be towards slightly shifted to the left side. And so sometimes you may see that the apex of the heart, for instance, you appreciate it more in the right side. Then it means there's something we call dextrocardia. Okay, so right-sided heart, okay, in some situations. Well, for instance, the spleen, which we expect to be in the left hypochondriac region, may find itself in the right side. Likewise, the liver, okay, the stomach, which we expect majority of it to be in the left side, may tend to the right side. So either, yes, situs inversus, yes, either partialis or totalis, yes, you may be experiencing some of these things. Now, my friends, in bringing the concept of Kartagener syndrome, in Kartagener syndrome, there's some classic triad. Okay, so there are three main things that you'll be expecting to see in Kartagener syndrome. Once there's there, then you know that, yes, there's Kartagener syndrome. Yes, number one is bronchiectasis. Number two is, of course, the sinusitis we mentioned. And then number three is what we call the situs inversus. Okay, yes, the other things could be accompanied with it. And that is why I'm saying that as far as this case study is concerned, then it's better we go with what we call, primary ciliary dyskinesia. Now, the other question for us is that, yes, what will be the management? What are you supposed to do, okay, to help manage with this condition? Yes, the first thing is that, yes, we need to look at the respiratory, yes, component, and that is by way of, for instance, looking at the chest, physiotherapy. Yes, we need to look at that one. Yes, of course, we need to also, look at giving some kind of, for instance, antibiotics, okay, to help with, of course, the infections as far as the respiratory, tract is concerned. Now, the other thing that we need to also look at, okay, for instance, in the case of the sinusitis, for instance, then we need to look at something called nasal saline irrigation, okay, together with, of course, some other topical antibiotics could be also be indicated. And then importantly, there will be the need, okay, that frequently we assess the individual's pulmonary function. Okay, so close monitoring is extremely important. Say that, for instance, some imaging studies will have to be done, okay, frequently, to check with some of these things, check the pulmonary function. Yes, do various tests to check these pulmonary functions as well. Now, if we are not able to do these things, okay, timeously and all that, then what will be the complications? Yes, no doubts that all these things, these signs and symptoms we are talking about, yes, could be complications themselves. Yes, like the bronchiectasis. Okay, so with time, that is when you'll be experiencing some of these things if they are not timeously, dealt with. Yes, there could be something called nasal polyps. Yes, not only sinusitis, but it could be nasal polyps. Some kind of eardrop-like, structures, okay, may develop in there, which oftentimes, if they are small, they wouldn't pose any much problem. But in situations where they enlarge, then they could occlude, the nasal passages for air to effectively flow in and out of, the respiratory system. Well, one thing is that there could be total respiratory failure if some of these things are not tremendously, dealt with. So I believe that, if you look at this holistically, then we understand that, yes, as far as the respiratory system is concerned, yes, these are the main things that we need to look at. Primary ciliary dyskinesia. Now, oftentimes people dwell more on, for instance, the fertility issues and all that. But the main thing has to do with respiratory thing, and of course the ear issues. So for instance, another complication that can happen could be, of course, ear loss. If there's that kind of frequent otitis media every now and then, yes, one day there may be that kind of ear, that kind of uh ear failure at all. Okay, so that you cannot hear. Okay, the impairment may be so extreme, say that yes, you cannot hear again. So I believe that, yes, you find these, important points very relevant as far as your studies is concerned. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.